In this month's teleconference, Jonathan will be talking about tackling respiratory disease. Now that the majority of cattle are housed, pneumonia can become a big challenge, affecting livestock health and performance. An outbreak of pneumonia can result in permanent lung damage and lower growth rates, which can cost the farmer around £30 to £80 per animal at risk. So without further ado, I pass over to Jonathan.
Thank you, Sarah, and thank you, AHDB Beef and Lamb, for the invitation to kind of basically pitch this today. I hope everyone can hear okay. If you've got problems, you probably will need to email in, as Sarah said. So I'm going to carry on the assumption that everyone can hear fine. So essentially, respiratory disease, as Sarah said, remains a massive challenge for the beef industry. It's something that I see literally every day in practice and can become pretty disastrous, particularly at this time of the year. And what we decided to do is really divide the topic into two halves. So we're going to break it up. So we're going to look at the key infectious agents that cause pneumonia first, together with some environmental factors. And then after a short set of questions, we're going to actually look at the animal factors and immunity factors. And the reason for doing this is the first big take-home message about pneumonia is it's about the imbalance between an animal's ability to fight off infection with good immunity and how big the challenge of pathogens and infections actually is. If we can get that balance in the animal's favour, we can prevent pneumonia and prevent the losses. So that's the big message really for the day. It's about comparing how big is the challenge of pathogens and infection in your farm versus how good are the animal and immunity defences keeping them out. So we need to either lift immunity or reduce infection challenge to actually prevent pneumonia. Okay, so again, as sort of Sarah already introduced, it's a really major commercial issue for the industry. And the point really about that is, more than anything else, it's not about the cost of treatment, it's about reduced growth rates and hugely actually about the reduced potential for growth and therefore increased feed costs. So we're looking at maybe about 20% of all growing calves have actually got some signs of pneumonia before actually kind of meat inspection, but we're seeing nearly 40% of animals going through kind of the beef cutting kind of room have got some lung pathology at slaughter. So we've got many cases where we're not noticing that disease is going on while the calf's actually alive. So these lesions can be low in growth rates, and that financial kind of cost is a really big part of it. So, pathogens first. Well, before we actually get into which the pathogens are, what are those major signs? What does respiratory disease look like? Well, obviously coughing, and that means that when you're going to go in and you feed up in the morning, the amount of coughing you hear is an important kind of guide. Even if animals come up to feed, if you're hearing more and more coughing in certain mornings, then that is some of those early warning signs. Clearly, discharge, often quite clear to start off with. Quite a few of the viruses, particularly IBR, produces clear mucus to start with, but then becomes thick and really snotty as secondary infection kicks in. Looking for increased breathing rate and increased effort. And then obviously into more severe cases where we've got, calves and adult stock with their heads down, looking depressed, not feeding, not coming up to feed, and raised temperatures, and of course, death in extreme cases. So they're the signs that are there every day, and keeping a handle on the behaviour of your stock, particularly at feeding time, is really important so we can get early intervention. Now, to find which specific, respiratory pneumonia viruses and bacteria you've got on your farm, then working with your vets to do some testing is really well worthwhile. We can do quite a lot of targeted things with both vaccination and actually with treatment, but we need to know what's actually happening on the farm. And the cost of this is often a lot less than you would fear. So we've got a few main ways of testing for what sorts of pneumonia you've got on the farm. The first one is actually quite simply doing some blood testing. And actually doing a bit of a survey where we might just blood test, say, half a dozen 6 to 12 month-old animals at the end of a kind of house period. We can get a bit of a survey of what sorts of viruses and bacteria that your herd have met that year. So we can take a single blood sample from animals in that kind of young stock group and get a handle on actually what they've met. And that can be useful as a survey, but actually it won't tell us exactly what's just caused your pneumonia 3 weeks ago. And to do that, taking a second blood sample a few weeks later can actually give us specifically what's been your recent challenge for pneumonia. It's called paired serology. It involves taking 2 blood samples 2 to 3 weeks apart immediately when you're experiencing pneumonia. So you need to do that at the time. The sort of survey bit I described first can be done after the event, but it doesn't give you a handle on exactly what's happened at a particular time. So blood samples are either a survey for a background picture or in paired serology need to be taken at the time of an outbreak. The second set of testing approaches is called BAL, which is bronchoalveolar lavage, and this involves essentially your vet coming along and actually washing out the kind of windpipe trachea and part of the lungs with sterile fluid and then sucking the sample back out. It sounds horrific, but actually it's very practical and easy to do. You just require a halter and a couple of bits of plastic tubing. We do it lots. It gives you quite early information about what's going on in the herd. And so again, if you're concerned that you're getting an outbreak happening, this is something to discuss with your vets about taking what's called a BAL or bronchoalveolar lavage sample, where you can find quite a lot of things that don't show up in just ordinary blood samples. Thirdly, unfortunately, there are often losses and deaths in pneumonia, and there's a wealth of really valuable information at post-mortem. So hopefully you won't get to that point, but if you do, while that animal is still fresh, it's well worth talking to your vet, and there's been pathologists such as Ben Strugnell, who's been supported by AHDB, running private, lab-based surveillance as well as government lab work too. There's lots of things we can find out from pneumonia post-mortems, in particular how severe, what type of pattern of lesions there are there that can really help with prevention. So, having seen signs of pneumonia in your animals and having done some testing, what sort of things might we find? Well, the main agents that cause respiratory disease in cattle split into 3 groups. We've basically got viruses, we've got bacteria, and we've got mycoplasma. Now, the viruses were the big 4 that were the real kind of main drivers of how pneumonia gets into cattle. And they are PI3, which is parainfluenza, RSV, which is respiratory syncytial virus, IBR, infectious bovine rhinotracheitis, and BVD, so bovine viral diarrhea is really important actually as a pneumonia virus, as well as reducing the immune system, letting other things in. Now those 4 viruses are often the way that the initial damage is done, which lets in other secondary infections on top. Now we've good vaccines for all of those viruses, so they're all preventable. There are good vaccines that are available which can actually allow us to get very, very good control and prevent the overall attack of pneumonia into herds. And we're going to talk about those in the second half of this, where we're going to look at the immunity factors. So the viruses were the big issue, but we have got quite a lot of improvement there with vaccines and the more uptake of vaccines we get. The second group are the bacteria. So Histophilis somnus, Mannheimia hemolytica and Pasteurella multocida, they're all great names. But these are quite often involved in a mix of different kind of pathogens that cause pneumonia, but they can also be primary invaders. So we've just recently had some calves that on one of our farms have died really rapidly, and we've diagnosed actually Pasteurella and Mannheimia as the cause. So these are bacterial primary causes of pneumonia, where they can come in and actually very quickly, in otherwise very healthy looking animals, they can cause severe pneumonia and death. They can also, particularly Mannheimia and Pasteurella, be involved after transport. So the stress of transport can be a really big factor with both IBR virus, but also Pasteurella bacteria infections with pneumonia. Now, Histophilus somnus is a bacterial infection that we don't have a vaccine for. We do have some vaccines against Pasteurella. We don't have a vaccine against Histophilus. And it's increasingly becoming a big problem with pneumonia that we don't get good protection from because we've no vaccines, and can be quite resistant as well to some antibiotics. So that's one to be aware if you've actually got on the farm. And the third group are the mycoplasma. And Mycoplasma bovis is a big issue, in that this can often cause, as well as pneumonia, but you can see swollen joints, you can see head tilt and droopy ears in groups of calves, and it can be a particular problem on units that have got shared teats, because it spreads very easily, for example in automated feeding systems in calf rearing. But it's also a really big deal, because once on a farm it can spread between kind of adult cattle who can carry it and spread it to young stock. Again, we haven't really got good vaccines at the moment, although there are some what are called autogenous vaccines that we'll talk about in the second half that might help with this. So that's our kind of group of pathogens, our group of different kind of bugs, and they can mix together in different combinations. And so we tend to see actually different patterns of infection in different sorts of farming systems. So for example, if we look at housed dairy-born calves and housed suckler calves, for example, less than 6 months, then we can often see the viruses like RSV and PI3 and M. bovis causing severe pneumonia with chronic coughing with the mycoplasma. Whereas often with suckle calves at foot, those severe acute pneumonias are much more likely to be about the Mannheimia, the Pasteurella type of infections and RSV. As we get slightly older, then, and we're seeing more runny eyes, runny noses, and upper respiratory pneumonias, then IBR becomes a really common problem, particularly in kind of older growing cattle as well as in adults too. And the kind of final kind of group is if we look at housed, weaned, dairy-bred calves, then actually there can be those severe acute pneumonias, and we mustn't forget lungworm, particularly after a kind of a warm, mild season such as this year, where late greys young stock have been very prone to lungworm. So just if we're going to draw this kind of pathogen section to a bit of a kind of final close, we talk about those kind of big four, and they do all combine together to make things a lot more severe. The first infections come in, and then secondary invaders make the damage much more significant. We mustn't forget that BVD is like the HIV of the cattle world, and so it does really reduce the ability of fighting off these infections. And underlying BVD is something that is really important to discuss with your vet about getting under control. We have got treatment. I'm going to talk about vaccines just shortly, but if we look at the treatments, it's worth just bearing in mind that I've been emphasising prevention very much so far, and that's because we actually don't have treatments directly for the viruses. We've got antibiotics which can be really helpful in controlling secondary infection, and we've got anti-inflammatories such as meloxicam, ketoprofen, for example, that can reduce damage. But we really want to emphasise that prevention is better than cure with all of these problems, because as an industry we're trying to reduce our reliance on antimicrobials, and also by the time you see those sick calves or you've done your testing, you've already had some lung damage that will have reduced feed conversion efficiency and daily live weight gain. So we're trying to do prevention as much as we can, and if not, then we have got antimicrobial options and anti-inflammatories that we can use, but let's not forget that there are long-term impacts obviously on overall performance, even if you do treat as early as you possibly can. Sarah, I think we're about at 15 minutes there, so should I hold fire there? I can carry on, but maybe should we pause for questions at that first section?
Yeah, no, that's lovely. Thanks very much. That's really interesting. So can I remind everybody that questions can be submitted by emailing brpconf@ahdb.org.uk, and I'll put those questions to Jonathan. Or alternatively, you can text 07775 884 851. So whilst I wait for the questions to come in, I'd just like to remind everyone that there are additional resources available on the AHDB Beef and Lamb website on cattle respiratory health, including a BRP Plus on pneumonia, which also includes a pneumonia MOT document, and these can be found in the Better Returns section of the website. So I've just got a question in, and it's asking, what are the costs of vaccination?
So it's a good question, particularly in terms of looking at getting kind of return on any sort of input in the industry at the moment. It's a little bit, I'm afraid, what's the length of a bit of string, because I'm going to talk about some of the vaccines that are available in the second half, but for example, it can vary between as little as £2.50 per calf or per grey animal, up to more than £10, depending on how comprehensive your vaccine program is. So we've got quite a range of vaccines on the market, and if you pick a single vaccine, for example, against something like IBR, you can actually get really effective control with a single dose for maybe only kind of £2.50, that kind of money. If you put in a comprehensive program against lots of different respiratory pathogens together, so you may be vaccinated against 4, 5 or even 6 different things, then you can look at the cost of that being more than £10. But again, we've got to compare that, of course, to what the cost would be of the disease.
Yeah, of course. I've just had another question come in, and it's asking, does fog fever fit in here?
That's a really good point. Fog fever it's not an infection. It's still absolutely fair that it's a respiratory problem, but actually fog fever is almost like an allergic reaction because of the production of a particular chemical when you graze, obviously kind of fog. And what happens is that you get an allergic reaction with lots of fluid production, which means that cattle will literally drown. And it can happen.
Nasty.
It can happen. It is really nasty, and it can be a really dramatic issue. So the key points with that are, again, contact with your vet straight away if you get sudden death or you suspect respiratory distress when you turn animals into new growth, new fog. Treatment can be steroid injections from your vet, but also removal of the animals from that particular pasture, and in future trying to prevent grazing when you've got the very, very kind of young growth, young regrowth on those kind of covers. Right,
lovely. And just a final question before we move on. This email comes in and it says, I use Respiratory 4 on 6-month stalls on the day of arrival from market, but do not get full cover until the second dose at 3 weeks. Yeah. What are my options to give better cover sooner?
Okay, that's a really good question, and I'm going to, if it's okay with the caller, I'm going to bring that into the second half because it's such a good question. It forms a really key part of the second. So I will answer that question. I promise I'll come back to it. There are options.
Thank you. Yes, if you'd like to start on the second pass, that'd be great.
Okay. Well, I'm going to kind of bridge these two halves with just a couple of minutes talking about the environment, because I said in the introduction that respiratory disease is all about this imbalance between the immunity and the defences of an animal, whatever age, but particularly obviously young calves, versus how big the challenge is that immune system's got to fight off. So just imagine it's how good your defences are, how good your armour is against infection getting in. Now I'm going to bridge these two kind of bits with just a couple of minutes talking about how the environment, your housing, whereabouts your farm is, upland, lowland, is so important for those two factors. And what I want to pull out of this is that we've got three really big factors in the environment. One is moisture, wet. One is fresh air, and the other one is air speed. And actually, those three factors influence both animal and immunity factors, and they also influence how much infection comes in. So, for example, let's look at moisture just for a minute first. If we've got conditions that are too damp, in other words, we've got leaking drinkers, we've got damp areas because of poor drainage, we've got poor guttering repair or big holes in roofs so that when it rains lots of water comes in, or we've actually got poor ventilation so that we don't get water out, then what happens is that all these respiratory pathogens I talked about will live for longer. It means that they will survive for longer and they will spread more easily. So damp conditions are a real problem. And if we can make things drier in every way, it will help both less favourable conditions for all the pathogens, in other words the infections, but also it's better for animals who, when they lie wet, get quite reduced ability to fight off infections. So moisture is a big factor. So think about all your housing. How can we make things drier all the time? The second factor is fresh air. And actually, imagine that fresh air is disinfectant for your air quality in your buildings. Literally introducing fresh air, by opening up, doors, shutters, lifting kind of all sorts of gale breakers, opening out, some spaceboarding. That fresh air actually means that you reduce the survival time of those airborne infections. And we also can remove things like ammonia and toxic chemicals that reduce the immune defences from animals too. So fresh air is really important. We can reduce how easy it is for infections to survive, and we can also make things easier for good growth conversion. Imagine running an engine. You need to get that mix of air and fuel right to get good growth rates, and that's exactly the same for cattle. But the third point is that introducing fresh air is not about having drafts. As soon as we start to get air speeds greater than 2 meters per second, and again you can work with your vets to measure that, then actually what happens is that we start to get excessive energy loss. Those drafts start to cause stress for animals in that building, and actually what they do is they reduce the immune system and how easy it is to actually get infections fought off. So we need to introduce fresh air and we need to get damp out, but we need to do that in a controlled way without really high air speeds. Okay, so that kind of bridges the gap, and that means onto kind of these animal and immunity factors, and this is where I will come to the vaccines as the kind of question asked. But before we do that, first of all, let's think about all those environmental things that I just said. Let's support immunity and make it easier for animals. It's such a big thing. You can often reduce your need for treatment or even reduce the need for vaccines if you can make those environmental factors really, really work well. So one of the things that we often do is we look at one thing at a time when they're all connected up. So let's start a little bit back at the beginning and think, where does immunity come from? And in a baby calf, it's from colostrum. Calf health hinges so much on getting good amounts of good quality colostrum. And that means that if you're in a dairy situation where you can measure it, we want to be getting 4 litres of colostrum into animals literally from the moment that they actually are born. In a beef suckled situation, of course, that's down to the dam, but what we can make sure is that the dams are managed in good body condition and that we can provide an environment where it's easy to get good mothering and access to the dam for the calf is as easy as possible. We think around as many as, sort of 35% of calves don't achieve good colostrum intakes, and probably, around 8% of our deaths after calving are actually linked to poor levels of colostrum. So we've got to bear in mind it can be difficult to intervene. You've got to be careful in terms of safety issues with sucklers. But if there's a cow that's been injured after calving and can't stand up, it's obvious that calf isn't going to suck. And if a calf's standing there with, clapped in guts, clearly not having managed to get to a teat, or a cow's got mastitis, then you need to get in and supplement colostrum. So there needs to be enough. We usually don't give enough. We probably need to be nearer to 15% of body weight in that first 6 hours. Timing's critical. Don't delay. Every 10 minutes that you delay is harder and harder to make up for it. And also quality with colostrum. We need to make sure we've got cows in good body condition. And if you are supplementing, keep it clean. And in summer, keep it cool. The level of bugs in colostrum stops good transfer of immunity. Okay, so colostrum, got to say that's really important in beef and dairy systems. But the second thing about immunity is actually nutrition. It's not just about those antibodies coming across. All malnourished animals have got poor immunity. And so it's difficult sometimes to actually intervene directly, but we can provide creep areas. And doing that early on in beef suckle systems has been a massive, massive help in quite a lot of the herds that I work with. If it's difficult to keep calves in dry, clean conditions, we can create well-bedded and clean and dry creep areas and obviously supplement food over there as well. So let's not lose the opportunity for kind of creep feed, both outside at grass as well as inside. The mixture of concentrates and fibre is important because rumen development is all about concentrate feeding. Forages are often not digested that well by young calves, although they can be still a help. So let's not forget it's all about concentrates for those young animals. Okay, so feeding, can't emphasise enough, is absolutely vital for getting good immunity, first of all with colostrum, and then secondly, let's make sure we've got good nutrition, good growth rates, and if you can measure growth rates in any way with weighing, fantastically helpful to understand what your targets are and whether you're getting there. Second big area then after nutrition is stress. And stress can mean lots of things, but the point is that they add together to make things really, really significant. So one stress on its own might not be too bad. By the time you put 3 or 4 together, then we've got a huge risk of getting pneumonia. So first of all is exposure risks. So in other words, you move together animals of different groups, particularly different ages. So as you mix together different ages of stock, older animals will shed disease, they'll shed infection, and they'll cause disease in younger animals. Similarly, if we bring together sick animals and we don't actually move them out of pens, then although of course it's difficult to reintroduce, for example, bulls back into a pen, if you've got some chronically sick animals that you keep holding back and keeping in the same pen, they essentially just spread infection to each new batch that you bring through. So there's exposure to infection. Secondly, we've got stresses of things like castration and disbudding. We want to try and do those things as early as possible and not do lots of these things at the same time. They're too much. Environmental stresses become important. So, for example, change an environment, so either housing or turnout. Transport, critical stress factor, either moving to different parts of the unit or moving back from a mart or moving from actually a young stock part of the system to a growing area. Transport is a huge stress that brings on a lot of pneumonia. And then let's not forget that we get kind of the emotional stress when you actually look at weaning too. So we can improve defence if we reduce stress. So if we avoid doing disbudding and castrations at the same time as weaning, and that's really important, particularly for beef from the dairy herd, then that actually can reduce some of the stress risk. And instead, while we've got good circulating levels of colostrum, doing those things younger are actually much less of a problem. Keeping herds stable, trying to keep groups in stable social areas so that we don't actually create lots of pecking order fights. Every time you mix groups up again, we cause quite big stress. And also keeping routine and trying to do the same things at the same time. Part of the stresses that I think are really critical are about bringing in new animals and basically the risks of bought-in stock. Risk-based trading's been talked about a lot, particularly with things like TB, but actually it's so easy to buy in infections such as BVD or IBR if you buy from the market or you buy from other farms without discussing with your vet what the risks are. We have a huge opportunity to reduce pneumonia risk by actually testing first. So let's think about kind of actually, working out what the risks are of buying in infection and doing some testing first. And part of that, of course, is that BVD and also diseases like coccidiosis are really important. Right, on to vaccines. So last but not least, vaccines are a critical opportunity for improving immunity. But you do need, first of all, you do need to do those other factors I've just been discussing. If you've got an animal that is malnourished in a group of animals that constantly changes, that's exposed to drafts, then it's very, very difficult to get the best out of your vaccines. So that's the first thing is look at the environment, look at your group management, and don't expect vaccines to be a magic bullet if everything else is wrong. That said, we've got some great opportunities with the vaccines that are around now to actually make big progress. So I'll go into a couple of examples and details, but also just want to make the point that first of all, they do need to be stored correctly. There's a huge number of vaccines that get picked up and they're meant to go in the fridge. If they sit in the kind of front seat of the pickup in the middle of August and they cook, they really don't work. So, collect them in a cool bag, get them back in the fridge. So pick them up from the vets in a cool bag, bring some ice box or some frozen peas or something and make sure you get them back in the fridge for them to work properly. Use them at the right time. If these vaccines need 2 doses 3 weeks apart, they need to be 3 weeks apart. There's probably only a couple of days leeway each side. It's really important that you do them at the right time. They don't work as well if not. Secondly, do use the route of injection. If it says, into the muscle, do them into the muscle and make sure you've got a good kit. And finally, if you've got an animal that's already got disease and you vaccinate them, it is unlikely to work properly. It's really unlikely to actually do the job that you expect. So on to specifics, and to kind of really round this off with just some kind of specific vaccine programs. Well, the question that I was asked, I think is absolutely spot on, is that, for example, with programs such as Respiratory R4 and other multiple dose systems, killed vaccines, so vaccines that have got dead infection in them, often require 2 doses to cause a primary course to establish actually protection. And that does mean that in between that first injection and second injection, you do not have cover. So it needs to be that you are using those regimes well in advance of when your infection challenge will be. The question was, what could you do in terms of on arrival? Well, there are live vaccines and there are intranasal vaccines you can give up the nose that actually give you much more rapid protection. And actually some of those, particularly IBR vaccines, can be given even in the face of infection. So all other vaccines need to be given to healthy animals, but live IBR vaccine can actually be given up the nose, not by injection, but actually up the nose because it stimulates the immune system of the calf. So a couple of examples to answer the question would be you could use products like Respiratory intranasal, or you could use products, for example, from companies like Bacterial IBR that you can give on arrival that are single dose, rapid onset. So within a couple of days, and in some cases less time, you could get protection very quickly. They don't always last as long. So, for example, Respiratory intranasal probably gives you 10 to 12 weeks cover, versus 2 doses of Respiratory R4, for example, would give you up to 6 months cover. But you can get rapid onset even if it doesn't last as long. So there's lots of other kind of examples out there, and there's lots of companies producing vaccines, but I would say there are single dose live vaccines out there if you discuss with your vets that you can give on arrival that will give you much more rapid cover. The final bit on vaccines that I'll probably just say, and then I think we're on time, Sarah, is
yeah, we are doing very well.
we don't have vaccines for some of these infections, for example, like Mycoplasma bovis that I talked about. There aren't vaccines on the market in this country. But in the pig industry, about 20 years ago, they suddenly got Mycoplasma vaccines, and it's made a massive difference to their industry. Now, if you talk with your vet, there are what are called autogenous vaccines that you can kind of make up special vaccines against Mycoplasma. And they have variable performance, but they can help if your particular problem that you've tested and found out on your farm is Mycoplasma, then you can actually make these kind of farm one-off autogenous vaccines against it. So we have got some kind of new weapons that are emerging. But I think instead, for it to close this part up in terms of the immunity, vaccines are a great tool. There are a range of things out there. If you discuss those with your vet, they can find the appropriate ones for you to use. They're a huge opportunity to reduce the cost of pneumonia. But they'll only give you that if you handle them in the right way, and also don't miss the opportunity for improving the environment and reducing all those management stresses that I've just discussed, because you will get a lot more return from your vaccine investment if you do that. I think that's probably about 15, Sarah, if that's okay.
Yes. No, that was very well timed. Thank you. So just while I wait for some questions to come in, I'd just like to promote a couple of events which AHDB are hosting. So the first one is the Winter Silage event. This is a joint event for both beef and beef and dairy producers. The first one is at Cheshire on the 4th of January, then it's at Lancashire and Skipton on the 5th of January, York on the 6th, Northampton on the 7th and Brackley on the 8th. There's also a beef finishing roadshow at the end of January. This will be in Cornwall on the 25th, Gloucestershire on the 26th, Northamptonshire on the 27th and Staffordshire on the 28th of January. So you can find more details about these events on the website, which is beefandlamb.ahdb.org.uk. And bookings can be made by phoning the Beef and Lamb Events Office on 01904 771211, or you can email the events team, which is brp.events.ahdb.org.uk. So I've just got a question. What is the cost of the intranasal spray against, say, Respiratory 4?
So typically, we're looking at less than half the cost.
Right. Okay. And can these be given to cattle of any age?
Essentially, yes.
Right.
So Risperdal intranasal is licensed to be given from about 7 days old. So it can be given very early on, and actually is a real opportunity for giving early protection, particularly in beef farms and beef systems where you're finding pneumonia is a problem in young calves. But you can give it in older animals too. But from 7 days old, and it's a single dose. It only lasts for 12 weeks, so you may need to revaccinate with it. But it certainly gives, with a single dose, from only 7 days old, you can get really good protection against RSV and PI3.
Lovely, thank you. And you were talking about the environmental factors which can affect pneumonia. I've just got a question come in that asks, do calf coats help reduce stress and therefore pneumonia?
Really good question. Yes, they do, as long as obviously they're kept clean and dry.
Right.
But what calf coats do is that if there is those high air speeds, for example, that I described, more than 2 meters per second in particular, then of course calf coats can help reduce some of the effect of that. And also, again, they offer some protection if things are really, if you've got direct kind of like, wet in terms of exposure to rain. The downside, of course, is in a very humid environment where things are already very, very sweaty. There can be a risk actually of essentially having very, very wet conditions underneath the coats. So all I would say is just bear in mind that they are dry and not still too wet and sweaty underneath.
Okay, lovely. Thank you for that. Another question has come in, and it asks, what is metaphylaxis and why is it important?
So, well, this is a really kind of big topic at the moment for the beef industry in particular. So there's a lot of pressure going on to reduce how many antimicrobials, how many antibiotics are being used, and there's a risk that we'll actually lose some of our really important antibiotics for the animal health industry because the medical kind of profession want to kind of hold them back for humans. So essentially we're under pressure not to use antibiotics in a preventative way. In other words, if something hasn't got an infection, to give them long-acting antibiotics. What metaphylaxis is treating the rest of a group when some individuals have got an infection. So if there's a pen with no signs of any pneumonia at all, actually it probably isn't a good move to actually give them antimicrobials. On the other hand, if a third to a half of one pen has already got pneumonia, then we are looking at justifying giving the rest of that pen some antimicrobials and anti-inflammatories. And so metaphylaxis is basically treating the rest of the group if you've got some animals affected already.
Lovely, thank you. So does the use of antibiotics when the calves first arrive affect the effectiveness of the use of antibiotics when the calves are older? Is there any research looking at that?
Yeah, and this is a really big risk, is that by giving blanket use of antibiotics on arrival, for example, we're creating conditions for resistance that mean that those antibiotics won't work later on. So we've got vaccines that we can use in a preventative way on arrival, and we've also got anti-inflammatory drugs that we can use to reduce those risks on arrival. And if we can focus on those and reducing stresses, it'll mean that we can keep back antimicrobials for when we need them, because we're seeing increasing problems with resistance by using them in that kind of preventative way.
Lovely. And the final question, how do you best manage dairy cross calves coming onto a rearing unit from a mix of dairy farms of unknown health and colostrum status?
Well, the first
tricky question.
It's a good one to finish on. We could take a farewell with this one. So it's a great question because obviously it happens a lot. And the first thing I would say is, if possible, try and see if you can source from known sources where you can get a handle on what their colostrum status has been. And I know it's easy to say that, but I have to make that point that, you know, you've got all of the high risks together with what's just been described. And if it is possible to do any direct sourcing, you really can reduce quite a lot of those risks.
Yeah.
But if you are buying, in that way, in terms of obviously dairy derived, kind of beef, and you buying them and mixed up, then actually there are increasingly, for example, pre-vaccination schemes. So there are things that can be done before you get them back to the farm. So, for example, there's schemes like Sure Calf, where there are actually calves that are sold with independent certificates that they've had their vaccines before they went to the market. That's one thing. You can actually buy animals that they might be mixed, but they come saying these have already had a proper program at the right time. That's one thing. You can actually buy kind of certified vaccinated animals with the dates on and what they've had. But also, secondly, when you do get them onto the farm, I think you can look at reducing those stresses by keeping the things we just described. So in other words, keeping stocking rate as low as you can, looking at giving those intranasal vaccines when they arrive to try and boost immunity, and making sure that you maximise feeding space and opportunity and keep animals dry, well ventilated without drafts. you will minimise the risk and keep them in stable units. So even though they come as a mix, once you put a group together, try and keep that group together in an all-in, all-out kind of management plan.
Lovely. Thanks ever so much. So just a quick reminder that you can request the expert view sheets, which Jonathan has kindly prepared for us by emailing brpconf@ahdb.org.uk. The next teleconference will be held on the 8th of January, again at the same time, 1:30, and Adam Quinney will be talking about the use of technology to improve the management of finishing systems. Finally, I'd just like to flag up that our Beef Feeding Club e-newsletter will be out at the end of the month. This is sent out bi-monthly and aims to provide farmers with the latest news and interesting information about feeding cattle. Please let us have your email address if you would like to receive this. Email brp@ahdb.org.uk and ask to subscribe. So it doesn't look like there's any more questions coming in, so I think I'll bring the teleconference to a close. I'd just like to thank Jonathan for his very informative teleconference today, and I hope the listeners found it both interesting and informative. Thank you very much, and have a good afternoon. Bye.
Bye.